Government has decided to take a decision to cancel the arrangements with 4 private security firms to provide neighborhood patrols throughout Trinidad and Tobago. Minister of National Security Stuart Young, at a media conference a short while ago, said there were a lot of voices opposed to the partnership, even though this was agreed to in 2014 under a previous administration.
National security, after consultation with the Prime Minister, we have taken a decision to immediately cancel this residential patrol system, and as at this time, I'm going to be approaching the 4 security companies, thanking them for stepping forward in a very short time frame, because the first meeting took place last week Friday or last week Thursday, and I asked them to be ready to commence on Monday of this week. They moved heaven and earth to be able to provide that additional layer of comfort to us in Trinidad and Tobago.
The daily update on the progress of COVID-19 in Trinidad and Tobago was given by the Director of Mental Health, Dr. Hazel Othello.
Today, the total number of hospitalized patients is 98. At Cora, there are 26, and they are all stable. At Gov't, there are 72, one of which is in the ICU, but that person is not ventilated and is currently stable. There are also 3 persons at Gov't in the HDU and 68 ambulatory persons. Of those 68 persons, 17 have been identified for movement to a step-down facility with the ultimate goal of being discharged back into their communities.
Dr. Othello also spoke on mental issues at this time, saying that getting support within the community is key to bringing help to those who may be feeling anxious or even depressed.
There are always people that you can turn to, people you can lean on, friends, family, pastors and priests and other religious leaders, community leaders, people you respect, people who can be trusted to provide positive influences on your life. And those are the people who we usually turn to when we're not sure that we're doing well or when we think that we need some advice or some support. That is excellent, and to the extent that that meets the need that exists at the time, that is all that is required.
She says that those who may need higher levels of care, such as assistance from a social worker, psychologist, or psychiatrist, can access this through the regional health authorities. The doctor says these organizations are still functioning and can provide counseling services and more. All this within the framework of physical distancing to provide safety for both patient and healthcare professionals.